Welcome to Medical Reality Talk Show. I am Dr. Augustine K. Bala and I'm excited to be here with you. I'm the head of our team here at the International Christian Medical Fellowship, and I'm excited to be joining the team today as we talk about hypertension. So this month our focus is on issues related to the heart, since we're gonna be celebrating World Heart Day on September 29th. And so on the 24th of September, our next edition will be focused mainly on issues related to the heart, and we're gonna have a cardiothoracic surgeon and a cardiologist during our presentation during our next edition. But this edition is actually a talk and awareness related to one of the common diseases related to the heart. So today I'm joining the team as we talk about hypertension, and all of our team members going to be giving short talks and on different aspects of hypertension. So we want to say welcome as you join us to have this talk today. So we're going to have a very short talk from each of our team members, and we're going to be welcoming comments and questions in the comment section as well, so we can respond to that. So we want to welcome you to this edition of Medical Reality Talk Show. Hi, I'm Dr. Augustine K. Bala, and I'm going to be giving a little overview and talk about the pathophysiology of hypertension, and then my colleagues, our team members, each will be giving a little talk about different aspects of hypertension. And so let's define hypertension. According to the American College of Cardiology and the American Heart Association, the actual definition is at two levels. So one is that where you have the systolic blood pressure between 120 to 129 millimeter mercury, and the diastolic blood pressure less than 80 millimeter mercury, and they call that elevated blood pressure. And the second level is where you have the systolic blood pressure from 130 to 129 millimeter mercury, and the diastolic between 80 to 89 millimeter mercury, and that is when it's defined as high blood pressure, preferably stage 1. But there is much more details definition of different classification of high blood pressure according to the JNC. The JNC is the National Joint Committee on the prevention, detection, evaluation, and treatment of high blood pressure. Right. So the JNC definition is clear. It gave what is normal blood pressure and what is pre-hypertension stage 1 and then stage 2. So according to the JNC, a normal blood pressure is where you have the systolic less than 120 up to 120 millimeter mercury, and the diastolic at lower 80 millimeter mercury. And then pre-hypertension is defined as the systolic blood pressure between 120 to 139 millimeter mercury, and diastolic between 80 to 89 millimeter mercury. That is pre-hypertension according to the GNC definition. And stage 1 is where we have the systolic blood pressure between 140 to 159 millimeter mercury, and the diastolic 90 to 99 millimeter mercury. That's stage 1 hypertension. So stage 2 is where you have the systolic blood pressure from 160 and above, and then the diastolic 100 millimeter and above. That's stage 2. So you have stage pre-hypertension, and then stage 1 and stage 2. Well, so that's basically the definition of hypertension. Well, why would we want to be talking about hypertension, since we want to create awareness on hypertension, and we're going to be talking about the heart. Actually, hypertension is the most common primary diagnosis in many countries, and just in the US alone, you have, in the United States of America alone, you have over 86 million people from the age of 20 and above that are diagnosed with hypertension. And in many other countries, is the most common diagnosis in the clinic and everywhere. So, and it's related to the heart, and we're talking about the heart this month. We thought it would be good to create awareness about this very common disease that many people experience and suffer from. Apart from that, it is a risk factor to many other diseases that are related to many other organs. And so today you're going to have cross sections of doctors from different area or specialization talking about hypertension, but actually because it's multifactorial, it is a risk factor to stroke. Stroke patients who may end up to a neurosurgeon, right? And so it's also a risk factor for myocardial infarction, vascular disease, and chronic kidney disease, and many others. So talking about the pathogenesis of hypertension, like I just said, hypertension is a multifactorial disease. So it is very, very complex. The pathogenesis is complex. So let's take, for example, one of the major organs. Initially when we talk about hypertension, we just think, I initially, even before going to medical school, every time I heard hypertension, the only organ that came to my mind was the heart. And so, yes, of course, you're not surprising. We're talking about the heart this morning. We chose hypertension. But hey, hypertension is not only limited to the heart. Let's take, for example, talking about the pathophysiology. The kidney is both a contributing factor and a target organ, a contributing organ and a target organ in hypertension. And so, the kidney, when we talk about hypertension, we can the part the kidney plays there. So when we talk about pathophysiology in the first place, the physiology is the normal function, right? So the pathophysiology is the abnormal function as a result of disease, as a result of abnormality. So there should be a normal function that should lead to a normal blood pressure. But when there is a change, when there is a disease that affect that normal function, then we call it pathophysiology. So in the layman term, there is this abnormal function, right? Because of disease state. So that's the pathophysiology. So like I was saying, hypertension is multifactorial, and so that take, for example, the kidney is both contributing and target organs. And there are many diseases involved in the interactions that lead to the mechanism that cause increased blood pressure, hypertension. And some of the factors that play a very important role in the pathogenesis of hypertension includes genetics. Like one of my colleagues will be talking about the risk factor. You will hear her talking about how race is one of the risk factors that the black race, hypertension is more prevalent in the black race more than the Hispanic and other race. So genetically key role there, right, in the pathogenesis of hypertension. Also, activation of neurohormones plays very key role, and that is very complex. How the activation of the different neurohormones play a key role in the pathogenesis, like the different sympathetic nervous system, the renin-angiotensin aldosterone system. That's a whole complex thing. We may not have the time to explain here, but yes, that also play a very important role in the pathophysiology of hypertension. Another thing that is worth mentioning, obesity, and then also increase in dietary salt intake. These are the major factors that play a very key role in the pathogenesis of hypertension. And when we talk about increased blood pressure or arterial hypertension, is actually the condition where you have a persistent elevation of the blood pressure, right? So, and there are very important factors that I think we need to know, that system elevation of pressure. So one of those factors, whether for long-term or short-term regulations, these factors will play a very key role, whether short-term or long-term regulation of the blood pressure. These factors are very important to be mentioned and to know when we talk about the pathophysiology. So one of the factors is the cardio output. So the cardio output and the vascular resistance, those two actually determine the blood pressure, right? So the regulation of the cardio output, that talk about the circulatory blood volume, is very, very important. And then also we talk about the vascular resistance, so the vascular caliber, the elasticity, and the reactivity. And then of course the hormonal mediators, and then the neurostimulations. So these are factors that play key role in the pathophysiology and the pathogenesis of hypertension. Thank you.
Hello everyone, I am Joel Chokokawi, and today my team and I are going to give you awareness about hypertension. So I will basically be talking about the etiology of hypertension. So let's get to know what is hypertension. Hypertension is high blood pressure within the arteries that carries blood away from the heart to the rest of the body. You could also define hypertension as a psychological stress on a person. And we all know that hypertension is very common in our surrounding, in our environment. So, to know the etiology of hypertension, you have to categorize hypertension into two phases: primary hypertension or essential hypertension, and secondary hypertension. So, in primary or essential hypertension, firstly, you have to get to know the etiology, and the etiology of this type of hypertension is quite unknown. However, it is associated with lifestyle, environment, and aging. So this type of hypertension is more common in people of 50 years and above. And the environment has to do with their diet and lifestyle changes. And most especially the lifestyle relates to that of being seated in one position for a long period of time. So this type of hypertension usually does not just occur, it takes a long while. So it's usually found in people that spend all of their time, basically working in the same position without moving. Because when they are not moving, their energy tends not to flow. They become very static, and that relates to high blood pressure over time. Now, this takes us to secondary hypertension. So secondary hypertension occur due to failures of medication or medical complications, and also it is associated with diseases, of the body. That includes diabetes, heart diseases, obesity, and smoking, and that of contraceptive. So, to know the etiology of this type of hypertension, secondary hypertension, the etiology is directly related to the cause of the disease. So if a person has diabetes, the etiology of diabetic hypertension relates directly with the disease diabetes, and that is the same for all of the rest of the disease. So as long as you can treat the hypertension, you can treat the disease, underlining this hypertension, your hypertension can be cured. So secondary hypertension, there is a possibility that it has a solution, unlike primary hypertension. So guys, thank you for listening to my presentation.
Hi, and welcome to this session. In this session, we're going to talk about risk factors for hypertension. Earlier, we spoke about etiology of hypertension. So risk factors, what are risk factors? Risk factors are traits or lifestyles that influences or increases our chances of getting hypertension. So any lifestyle habits that increases one's chance of getting hypertension, we call that risk factors. We group them under modifiable and non-modifiable risk factors. So with the non-modifiable, they are difficult to change, whilst the modifiable, there is the capability of us changing it. So we'll be talking about some of the common risk factors or the well-known risk factors, and let's start with the non-modifiable risk factors. So with the non-modifiable risk factors, they include age, increasing age. So the older you get, the higher your chances of getting hypertension. So hypertension will be more common in the adults than in children. And also sex. Women are as likely as men to get hypertension. At one point in time, there is an equal opportunity or equal chance of men and women getting hypertension. Research also shows that our race has an influence on us getting hypertension. So there is an increased risk factor for the Black community than in the white or Hispanic community. So being Black, you're at higher risk than the other race. Also, family history and genetics play a role. Some diseases run through the family. So we believe that as a family, we have similar or common lifestyle. So, and that can increase our health and potential risk factors. Also, so let's talk about the modifiable risk factors. So with the modifiable risk factors, like we said earlier, we have the capability of changing them. So they include dyslipidemia, that is elevated lipids in the blood, and diabetes. 6 out of 10 people who have diabetes also have hypertension. So there's an increased chance of a diabetic getting hypertension. We also have smoking and alcohol. They would damage the heart and the blood vessel, and it can lead to hypertension. We also have obesity and physical inactivity. When there is excess fat in the body, the heart would have to pump so hard to be able to supply the whole body with oxygen and blood, and that is so much stress on the heart and the blood vessels, which can eventually lead to them losing their elasticity, and it can lead to hypertension. We also have unhealthy diet, food high in fat, sodium, and not eating enough fruits and vegetables, especially eating a lot of processed foods can increase your chances of getting hypertension. These foods are not very healthy and they can damage the blood vessels, leading to hypertension. These are many other rules. These are many other factors play a role in we getting hypertension, and as such, we have to take very good care of ourselves. We'll be learning more about the pathophysiology in the next session. This has been brought to you by International Christian Medical Fellowship, ICMFEL for short. Thank you very much for listening. God bless. Shalom.
Hi everybody, my name is Dr. Victoria and I am here to talk about the symptoms of hypertension, aka high blood pressure. But before I get into the symptoms, I just want to explain that hypertension or high blood pressure affects a variety of systems or body parts. And this is because most, if not all, of the body parts or systems do depend on the pressure within the blood vessels to be normal. So these symptoms might sound a little bit too vague or general, or it might make you wonder, like, does that really sound like hypertension? But actually, these are some clues that could help doctors to figure out that what is actually causing these symptoms could be hypertension. So let's get started. So some symptoms, let's start with some common ones, could be like a very severe headache, a headache that just won't go away, or you feel so tired, as we call it fatigue. Someone could also say, I'm having a hard time breathing, or difficulty breathing, basically that it's hard to breathe. Some could say, oh, I have chest pain here and then, which kind of sounds like a heart attack. And like I said before, that hypertension affects a variety of systems or body parts. Some could even say that they're seeing blood in their urine. We call this hematuria, which would tell you that the kidney now is involved. And also some could complain of an irregular heartbeat. They feel like their chest is like their heart is pounding out of their chest. Someone could say, I'm having this pounding behind my ear, in my neck, or in my chest. Also, some could say they're having vision problems, not being able to see properly, because as we all know, even the eye has a blood vessel supplying blood to it. And also some other vague symptoms could be depression, anxiety, sexual problems like loss of libido, bone loss, kidney diseases, heart disease, and etc. Even a stroke could be a symptom of hypertension. So yeah, these were some symptoms of hypertension. Thank you.
Hi there. So my name is Dr. Faustin. I am a master's student here in China. I'm doing cardiovascular disease. So I'm going to talk about how do we treat hypertension. This is what I'm going to do. This is what I'm going to talk about. And the people who came before me, like Dr. Victoria, Dr. Bala, and Dr. Eleanor, explain you guys about how do we diagnose it, what are the symptoms and all the stuff. But the question remains, how do we treat it? So I have a professor. One of my professors says something very, very, very crucial to me. The best way to prevent any disease, to treat any disease, as you heard, to treat any disease is prevention. So before I even talk about treatment, I'll talk about prevention. How do we prevent hypertension? So quickly, anybody who has a history of family member with hypertension should always watch themselves, meaning checking the blood pressure every now and then. When I say now and then, I mean every 3 months, every 6 months, you can go to the pharmacy, you can check your blood pressure. For anybody who has no prior, meaning no direct family member with hypertension, they still have to check, especially after a certain age. So it's better to check because of the food we're eating nowadays, because of the lifestyle we're living nowadays, we never know. So it's better to be safe. All right, so what I'm going to say here is let us all have the habit of checking our blood pressure, whether you have that risk or not. So that is what I have to say. And then now about treatment. First thing first, as one of my colleagues was talking about the division, how we divide the hypertension. We have stage 1, stage 2, and stage 3. So for anybody who has hypertension stage 1, meaning below 160, meaning the systolic blood pressure reading from 140 to 160, first thing first is we check their blood. What do we check in the blood? We check any risk of cardiovascular disease. So we'll check for the heart, we'll check for the kidney, we'll check for the brain. We'll run some blood tests, creatinine and BUN. We'll run all those tests. If it comes back negative, no problem. What do? We use the first method, the first line, which is exercise for at least 6 months. Lifestyle change and exercise for at least 6 months. I'm talking about stage 1 patient, anybody with rating of 140 over almost 150. Then they do exercise. If after 6 months there is no change, then we start giving drugs. And then to simplify everything for us, the drugs, we name them as TAC or TAC. The first one is thiazide, the second one is ACE inhibitor, and the third one is a CCB or calcium channel blocker. So as we choose among those 3 drugs, for the stage 1 patient, we choose one drug. And one drug, it can be either of the TAC, either one of them. So we choose one drug, we give it, and the target is different. The target is to reduce, right? We reduce from 160, we have to reduce it. From 150, we have to reduce it. For anybody who has no cardiovascular prior, meaning they don't have any problem with the heart, they don't have any problem with the kidney, they don't have any problem with the brain, for those patients, we target a blood reading of 140 over 80. But for anybody who has a prior problem with the heart, problem with the kidney, problem with the brain, the target should be 130. I hope that makes sense, because if you have a prayer with your heart, you don't want your blood pressure reading to be above 130, because that's just going to increase your risk for the heart. And after that, we'll check again after 3 months. If after 3 months the patient reading is still high, then we will increase the dose. So we'll use either we combine 2 drugs, TNC, thiazide, and ACE inhibitor. We combine them into 1 pill. We don't give 2 pills, we give 1 pill, so then the patient can take it easily. I wouldn't take 2 pills. Anybody wouldn't want to take 2 pills, but if you give 2 pills into 1, anybody would take it. So that's how we do it. And for any patient who has stage 2 or stage 3, the treatment is almost the same. We just increase the level and then we monitor. But for any level, stage 1, stage 2, stage 3, even the pre-hypertensive patient, anybody who's above 130, the first thing or the main thing that we have to do is decrease or eliminate alcohol consumption. Decrease or eliminate. If you can't eliminate the alcohol, guideline says at least 2 glasses, only 2 glasses a day. You can't take above 2 glasses of alcohol. I mean, beer, any light alcohol. And for there is exercise, we need to do at least 30 minutes of exercise a day. Yes, we need to sweat for at least 30 minutes a day. And then we need a lifestyle change, less salt, and then we have something called DASH diet. We eat food which is less fatty, we eat more fruits, and yeah, that's exactly how we manage and treat hypertension. Thank you so much, and I wish you a very, very, very good day or good night, depending on where you're following or when you're following us. Thank you so much. Bye-bye.